I did that too on my
phone.
phone.
Caroline Boyles, I use she, her pronouns. I'm the Director of Student Placement here at Dornsife, and I'm so excited to see so many of you here tonight at this event. This is the Exploring Public Health Careers panel that we've done for multiple years, and we're so grateful that we have some folks working in the field to share their experiences with you. So the design of this event is really to provide some context for the various sectors in public health. We have folks here from government, from academia, from nonprofits, from insurance, and from healthcare. And so I hope you all come with questions about what it's like to work in those sectors, how they found those opportunities, and how their experience in their public health programs prepare them. So I'm going to have them introduce themselves by going around and saying their current position, and of course their names, and their job titles, where they work, and a little bit about their role within their department. And you folks are sharing a mic right there.
Oh, that's a mic?
Yeah.
Do I pick it up or is it fine?
Yeah.
What's a mic?
Oh,
That.
go for it.
Okay.
No, that. The speaker.
So my name is Kevin Smith. I graduated in 2018 in the summer from the with an MPH in epidemiology, and I was one of the first students that was able to do the infectious disease prevention and control minor. So upon graduating, I started over at Temple Hospital. So I'm an infection control practitioner. So that pretty much means that I work in a small department. There's 6 of us. So it's 4 people that do my role. We have a data manager, and then we have a director. So all of the people that do my role, we round throughout the hospital, provide education surrounding infection control, what kind of measures you should take. If there's ever like any sort of cluster of cases or outbreak that people think are going on, we're responsible for putting that data together, presenting it out, and then figuring out what we should do with it. And then there's a lot of surveillance. So we spend a lot of time designating certain cases and reporting them out to the appropriate bodies. Sometimes it's a national database that we report it out to, and then other times it may be local health department or the state. So I think that's.
Hi, my name is Alia Naji. I use she, her, hers pronouns. I graduated just this last March, 19, with my MPH. I did my concentration in policy for HMP. And I'm currently right now working at Independence Blue Cross as a research analyst. I'm in the informatics department, so my actual title of the department that I sit under is medical cost reporting, which isn't like a great way to describe what we do. But I work with, under my manager, there are 4 other analysts, all data analysts with various skill sets, so working in different software. And then above her, my director, the entire team and people that I communicate with is pretty much like 10 to 12 other analysts. But then I also collaborate with other analysts in the whole organization. It's a large organization, I don't know, 70 people, don't quote me on that, but it's a big organization. So, what is the title? Sorry, I'm just double checking. Yeah, I think I answered all those questions.
Hi everyone, my name is Bianca Chang. I am at the National Nurse-Led Care Consortium, which is an affiliate organization under Public Health Management Corporation, or PHMC, which is a huge organization in Philadelphia. There's so many departments under it and other affiliate organizations. What I do there is I'm a public health project specialist, so I help manage some of the projects that we have, make sure that our deliverables are met, that we're staying on top of our stuff, meeting with project officers who represent the grants that we're given. And in addition to that, I kind of help with various random small projects as well, because we do a lot under the organization. But yeah, those are mainly my main roles.
Good evening, everyone. My name is Sarah Stevens, and I am do I have to hold this? Does this work? Does it work? Does it work? Can you hear me? No?
Yeah.
Yeah? Cool. Okay. I am currently a research manager here at Drexel School of Public Health. I work in CHIP with Dr. Suruchi Sood. I've been there for 2 years, and I came on a year and a half ago-ish as her research coordinator, and now I'm the research manager. And can I just get a quick show of hands? Who's a first year? And then second years? Okay, and is anybody currently working in research? Okay, so I just didn't know if you all are like all working with staff. I didn't want to tell you what we do on research projects, but so all of our grants are currently with UNICEF. We have a project in Ethiopia and Guinea that's working on the measurement of social norms around female genital mutilation. And we have a project that's just starting in Sudan about the way in which children are treated throughout the justice system and the attitudes and social norms and how they affect that. And then we're also doing a project on violence against children and using social and behavior change communication to design better projects. So those are all funded by UNICEF. I do a lot of proposal writing directly for UNICEF things. I do budgetary things. I manage research assistants such as Kenna over here previously. We do work planning, timelines, data analysis, data collection, tool development, anything that's involved in research. And then also I do travel a lot. This year, in the past, since January, I've been out of the country for 14 weeks. So it's a lot of like actually going and training local data collectors at local research agencies and developing those partnerships with people who are on the ground implementing the work.
Awesome.
You want this?
I think this works. Awesome. Hello, my name's Iman Adish, and I'm working at the Philadelphia Department of Public Health here in Philly. And so the organization, I'm under the Division of Disease Control, which is really large, but the hepatitis unit is more on the smaller side and is currently newer. We have like a team of 12 to 13 people. Above me is the program manager. And as the EPI, we have some coordinators and we also have some investigators who work with us. And my role, I do a lot of different things. I help with grant writing, I help with surveillance, I assign out cases, review cases, speak with providers who are reporting, and in addition to that, I also assist with data management and sort of analysis of a microelimination project here in Philadelphia amongst individuals who use drugs. And I also assist with dissemination of findings at conferences and just in the city as well, because we do town halls. Yeah.
Great, well, thank you, everyone. So how this is going to work is I have a few questions outlined that I'm going to ask, and then after a few, we'll open it up because many of you, I'm sure, have questions that you want to ask the panelists. So my first question, or I guess my second question after your intro, is how did you find the current role you're in? And if you've had multiple jobs since your graduation from your public health program, how did you find your first one? And you can go in any order.
So in terms of my job, I've only had the one job since I graduated. Pretty much I just did a vast search online to try to look for different jobs using different keywords. So since I did that minor, I tried to look at things infectious disease, infection control. So I think I ended up finding one on Indeed, which is a really good resource. They have a lot of stuff, especially in this area. And I just started shooting out like lots of resumes everywhere, hoping that I would get a call back. So yeah, thankfully I was able to get the interview. So I think I started around January. So I tried to start early, so that way a lot of times the process takes so long. In order to get, I've had a job where I applied and then not until 3 months later I didn't get a call or like an email or anything. So it's always good to start early. That would be my suggestion.
I actually first was kind of networking with someone from my department. I went to an interview for a depth or an ILE opportunity. And I was honestly just doing those interviews after I had gotten my ILE placement because I thought it'd be a good opportunity for me to get face time, so I would definitely encourage doing that. So that's how I spoke to my now current director. And then I went to another networking event that was Women in Technology at Independence Blue Cross, and then also met with the same director and asked her how I could improve my portfolio, what I could do to help my candidacy. Anyway, and then she said, actually, we have a job opening up, so I'll apply into that role. And then that still didn't really happen, and I applied to a different job in the same department. And then I sent her an email, hey, can you give me, put in a good word for me, since we had, kind of ongoing conversation. And then she's like, wait, we do actually have a job opening up. So then that's when I started with her team. So it was really great that I had the opportunity to, I actually saw the posting on Simplicity because it was an ILD posting for the internship. So that networking really helped me to get in. But I agree, definitely start early. Sometimes over the past like 9 months, 8 months I've been in my role, I've gotten declines from jobs I applied to like forever ago. So that's also really common. So good to always be putting in resumes, always be putting in cover letters just to make sure that you have something secured when you want it. Yeah, and this is my first job that I've held since graduation.
So just a question, is there any undergrad students here?
Oh, I didn't even ask.
Okay, just wondering, because I actually don't have my master's. I'm taking a break. I plan on going back for my master's next year. I'm in the process of applying right now, but either way, so just the background story, I graduated with my undergraduate degree from here, June 2018. And so between June 2018 and now, it's been a little over a year, and I bounced between 3 part-time positions actually, because it's hard finding a position in public health with just your undergraduate degree, because I'm competing with all of you guys who have your masters. So it was a tough world, but it's okay. If I could say anything, I would say don't be afraid to just like bounce around different jobs, even if they're part-time, because that's how I landed where I am now. And I also got experience and connections at 3 different places. Like I was at UPenn, I was at the Department of Public Health, and then now I'm here. So like I still have connections back at the 2 other places that I was at. And so if anything, I would just say don't be afraid to do that. And yeah, I started as an intern actually at the place that I was at now. And then 6 months later, they got a new grant and they had more money, and then they took me on full time. So, you know, in nonprofit world, that's always really possible.
Cool. So I think the only person in this room that didn't go to Drexel University. I went to Boston University and graduated in 2015. But after I graduated, I had a similar situation where I was working several part-time jobs. I was bartending and substitute teaching and volunteering on a political campaign and TAing, right? And then applying for full-time jobs that whole time. And so I would say definitely like there's this element of not getting discouraged, because a lot of people end up like piecemealing work together for that time. And I think this might be a later question, but just to jump ahead on this, like one of the things that I failed at in that first year was I would get an interview, and I had always gotten jobs I had interviewed before. So I would get an interview and it would go really well. So I would stop applying to other things, right? And then they drag me through the whole process and then be like, oh, we went with this internal candidate. So definitely, like, even if you start getting those interviews and those phone calls and that positive feedback, they may really like you, but they might not actually have any intention of giving you the job. So I did that for a year of, you know, that soul-crushing cycle. And then I went to and joined the Global Health Corps. And so I worked in Uganda as a research, what was my title? Youth Health Services Officer with the Elizabeth Glazier Pediatric AIDS Foundation. And that was really beneficial because one of the best things, it's a really interesting fellowship program, but it is actually a job. And they did a lot of leadership training, but it was also really good at networking. And creating like the connections, which I'll probably just say like informational interviews and networking 1,000 times to you if you ever want to have a conversation about getting jobs, because those are really how you get jobs ultimately. That's in my opinion. And I got this job because one of my best friends started working at Drexel School of Public Health and connected me. She knew that Suruchi had an opening, and she was like, hey Sarah, I think you're coming back from Uganda, you might fit this job. And she just sent my resume directly to Suruchi, and Suruchi was like, oh, she looks good. And I interviewed with the current research manager. And we were a fit, and you know, it's not nepotism if you're qualified. So I would just say, yeah, for me, this job and getting into the Global Health Corps didn't directly lead me here, but it did, you know, expand that network, which will definitely help you in the end.
So I would echo what everyone said, definitely network. I got my first job at the health department through my C-bump, which is now called the ILE. And I would say on top of that, a lot of local governments will post on Emory which is a really big one for us. We also post on Indeed for Philly. It'll be the Public Health Management Corporation and the Health Federation are two corporations that hold our grants. So I would check those, and yeah, definitely network. If you're a first year looking for an ILE, I would definitely consider doing a location or a place that you're interested in working at, because that's a great way to prove yourself. And when they get new grants or create new positions, they're more likely going to offer it to you.
So by Emory, you mean, is it the Public Health Employment Connection?
Yeah.
Yeah, so I see some of you taking notes. So if you Google Public Health Employment Connection, and it's an Emory Rollinsville Public Health website that pops up, but
Yes.
you're not in the wrong place, that's what it is.
Yes.
Can I add something on
yeah,
that?
of course.
I think one of the other things that makes finding a job hard in public health is that there's no standardization of titles. And I always found that frustrating in searching. I'm on Indeed, I don't know what to search for. Like, it might be a little bit more straightforward if you're like epidemiologist, but even if you're in epidemiology, there might be different titles. So I think one of the things that helped me was figuring out what the various titles are, and then just searching those. And you can do that by going on big organizations that you like and saying, okay, what are their kind of like entry level or just after that position titles, and then searching, because you're going to have to find different variations of the titles to get those jobs to come up. It's always it's a lot of times it's like project coordinator, program specialist. If you've ever done a systematic review, it's basically a systematic review of available jobs.
Just like another good point off of that is like, I think part of my job search was I didn't know exactly what I wanted to do either, and that makes it hard. So even just focusing on the tasks, and sometimes that can be awful, looking in the tasks and responsibilities because they're generic and that's not what you do, or that they're just, they're just fluff words. But for me, I figured that I really like the process of coding. I really like the process of doing research and being able to pull my own data and restructure it and do longitudinal analyses. And so to me, I realized I liked that specific task, and then that kind of led me away from doing more of like the program manager or program coordinator, because the roles weren't necessarily what I wanted to be doing every day. So I think that would be a good way to try to think through that process as well.
Oh yeah, and I would add, use those tasks to use those keywords in your resume, because a lot of us only look at resumes for maybe like a few minutes. And if you have those key phrases, you're gonna get past the screening process, which is either a person or a computer. So.
Can we talk about that a little bit in terms of what the hiring process looks like? So whether it's computerized, whether it goes through multiple people, and kind of are there first round, second round interviews? What does that look like?
Oh, yeah, sure. So if it's a computer system, we usually tell the company what words we're looking for. So if you don't use those words, you're not gonna get flagged. If it's a person who's reviewing it, I'm gonna look at a resume for maybe 2 minutes. If you don't look interesting based on certain words I'm looking for, sounds terrible, but, or if you don't show, for one thing, we use SAS. If you have no experience in SAS and don't display that in your resume, you're probably not gonna get asked for an interview. And usually what we do is we'll do a phone screening first, and after the phone screening, you will then be brought in for an interview, which is usually done by my boss and maybe one other person on our team. And based on that, if we really are interested in you, you'd come back to me, maybe the director of the division, along with some more members of the team.
Does the process look different for anyone else in other sectors?
Yeah. I'll say for PHMC, PHMC is kind of confusing, but I would say most of them go through HR first, and then it gets sent to the manager, whoever is in charge of the position that'll be coming in. Another thing that's kind of really annoying, I don't know how it is with other hiring sites and stuff, but if a job's been out there for a full 2 months, they may have already found the position, so don't apply to it or something like that. I don't know. Do you guys have different experiences with that?
Yeah, sometimes the hiring managers don't pull it down when it's
Yeah,
been filled.
a lot of times they won't pull it down. So
Yeah.
if it was up there for like 6 months or something, I would say just don't apply. I don't know, that's me, not. You want to say something?
Well,
I'm trying to save you guys
You
time.
can apply, but think about that if you're only applying to, one job a month or a few jobs a month, because that job might very well be a position that was taken already by someone else, or maybe they already have someone in the organization that's gonna backfill it, so they weren't even considering outside candidates, but maybe they'll phone screen you. There's like loads of things, and that's why I think for me it's like volume, connections. If you're, there were some students that I was speaking to that asked me if it would be odd to send multiple resumes to the same department or the same organization, and I'm like, no, send them your resume as many times as you want. If they want to stop seeing it, maybe they'll hire you. You know what I mean? But so I think for my process, my director has this statement that she says that she knows if she wants to hire you in 5 minutes, which is shocking to me. But they do a lot based on, okay, I can see your skill set based on your resume, and then the way that we're talking, considering how you might be able to develop a research plan, and think through. And I think for them, like being able to tell that someone's a very critical thinker just in the dialogue. So I'm very passionate about certain topics, and I think that type of passion was conveyed well in an interview. But after I had a phone screen, I had a meeting with different directors, and then I had a meeting with the vice president of informatics, and then that was when I got my job offer. So it still was, a lot of people that I had to talk to, but I think something else is that I from a more technical standpoint, I think when I was first starting to develop my resume, I was worried about putting certain skills on there, because I'm like, well, okay, but like, what, am I really good at it? Am I all right at it, And I think, like, if you think you can figure it out, which I'm sure most of you can use Google, put it on your resume. If you used it before, put it on your resume, and then look up research, questions that they'll ask you. Okay, so if it's SQL, so how do you interact with SQL? What do you use? Is there a search? So then look it up. What do people use to interact with SQL? And then it gives you the opportunity, because then you pass that screener that says that you know SAS, because they're not going to care if they kick you out from the get-go, because it's limiting their candidacies. And I think, I definitely did have a skill set in R and SQL, but my skill set in R and SQL now, since my role, has just completely flourished. And I wouldn't have, some things are so industry and department specific that you wouldn't have even known those things before you started the role anyway. So just really advocate for yourself, and if you think you can figure it out, put it on your resume. That's my
So for me, working in a health system, since they have so many people coming in for interviews and things, they usually use HR to kind of weed out the first beginning batch, and then they'll send whatever resumes they're looking at that they think are interesting over to the manager for them to decide who to come in. So you kind of have a lot of steps to get through to get that interview. So I think, as far as I know, they use the algorithms on the computer. So that's why it's really important to even if you're just pulling key things from the job description and making sure that that's in your resume, that can really give you an edge up. Especially because, what we do is a very niche thing, and for someone in HR to pick the right person, they're just kind of looking for key things to bring you in to kind of learn how much you know. So for me, to be honest, if I was to look at the description of my job again, the one that I applied for, I honestly was not qualified completely for the job. Because all of them say you need to have years of experience doing this and that. So my word of advice is, don't be discouraged if you're not fully qualified. Because there's plenty of jobs out there where they're putting that because they want people that are really going to push and try to get that job, rather than just looking at it, 2 years, move on to the next one. So that's my suggestion. They'll be willing to bring somebody in if you really seem promising. And also, as an entry-level person, if they bring you in and you're a fresh start, sometimes they prefer that because they can teach you the way that they do things, rather than having somebody come in that's been doing it for 10, 15 years. They get in the office and they're like, this is how I've always done it, I'm not changing it. So they look at you kind of as a blank slate, and they can teach you the way that they do it. So I think that's a lot of people look at it as a weakness, but I think that sometimes it's an advantage to be younger and like new to the workforce. So.
What did I want to add? Networking and using your contacts, right? To me, I didn't even officially apply for my job until I already had a letter in hand. Because my resume got seen by the people that need. And like you said, like I'm totally with you on like, yeah, beef up your resume so that you can pass these screeners, because it's really hard to pass those screeners. I might not feel confident in SAS, but I totally have data analysis, right? I do tons of data right now. I've used SAS once, so yeah, should I put it on my resume, like you said, to get in there, because I know how to use data analysis software, like quantitative software analysis software, whatever. I think I was happy to see that a lot of you are first years, because you should start informational interviews immediately, because that's how you get your resume seen by people. If you can so there's two ways, informational interviews and LinkedIn, right? But like, go on LinkedIn as soon as you're interested in a job and look for someone that might be working there and see if you're even like second connection with someone, and say to your friend that knows that person, hey, I just applied for this job. Would you mind putting me in touch with that person? Use those to get your resume seen, because really, I'm sure that all of you are very qualified. It's really just about being seen and getting past these initial 5-minute scans or these computer systems that have no, reverence for all of the hard work that you're putting into. But also start doing informational interviews now, because as soon as you do an informational interview, that person is your contact. Mm-hmm. So a year from now, when you're looking for jobs and you've already developed that connection with a person, you apply to the job, and then you already have their email, and you say, hey, I just applied for this job at your organization. Would you mind passing my resume to the hiring manager? And that's how it gets seen. And I would say out of all of my friends who work in public health, 9 out of 10 have gotten their jobs because someone gave their resume to someone else. So informational interviews start early, start now, immediately. I honestly would try to do 1 a month until you graduate, if not more, but that's just my opinion.
Right, so I'll pause for a second. I have plenty of questions if there aren't any from the audience, but I do want to take a second, and I see one in the back. Yeah.
I guess I'll stay. I was just wondering, like, during your job interviews or your internship interviews, have you ever had a situation where, like, maybe they'll give you a data set and say, solve X, Y, Z for me in a certain amount of time, or, I don't know, just, like, testing your skills? Because I could say I know SAS, but if I can't do it, is that really going to help me or not? I don't know. Because I've heard that happening in other sectors, but I don't know if that's the thing about public health.
So I'm going to repeat the question just so the folks online can hear. So the question was about being tested on a specific skill set in a job interview setting.
Yeah, I think that's why it's key. So for instance, I would say I did that with SQL. Maybe I put that I was advanced SQL or something, and I was like, we'll see how this plays out. But then the thing that I did right before the interview was say, okay, people who are in interviews who have SQL skills, who have a SQL skill set, what are they doing? Also, SQL is a coding language, just in case I didn't know what it was, like, a year and a half ago, so there you go. So for me, then I'm saying, okay, well, what are questions that they might ask me? So then you'll know you're prepared. The most technical question I got was how I interacted with SQL, but I did see online, they might ask you how to write, maybe there's this table and you need to retrieve this value, how would you write that? So I have seen things like that. For other software, I think that's a lot harder to do, because I don't know that much about how they might ask you some things, but I'm like, if in a lot of instances they haven't asked, it might be okay. And the other thing is, like, don't do it if you're scared you would never be able to figure it out, have the confidence that you can fit, and most of coding is Googling how to do something and finding code that somebody else already wrote. That's half of code. I mean, everything that I have done is by Googling, or I find out someone in my department has written this function that can do this thing, and I'm like, oh great, now I don't have to do anything, I can just copy and paste your code. I'm not saying that my job is like very easy, like that's not the whole thing. But the thing is that like, I think there's this black box about coding and software and how do I do it, and if I, but just like start reading about it, start reading what it is. It really is just like a language, just like when you type 2 + 2 in your calculator, instead in R, it's sum, and then the data set, and then the $sign, and the variable name. So it's really just like, start thinking about the syntax, or take a class if you're interested in that too. There's a great class in the College of Computing and Informatics called Database Management Systems. I took that one SQL class and I felt good enough to apply into this role. So really all it is having the familiarity of it, because if you're familiar with it, you'll know what to look up, and then you'll know how to prepare for your interview.
So we do ask for some code, and we'll ask you to give us something from like your ILE, just to see what you've done with SAS. We will ask some basic questions as well, and you can quickly tell when someone has never really used it. But that's about it. I've heard of, I think it's CHOP who does a test during their interview process, but yeah.
This is something that isn't super related to like programming skills, but like other skills that you might be asked to show if you have or not during an interview. Like one time I interviewed for our research interviewer position where I would be interviewing those who had substance use disorder and stuff like that. And so during the interview, I had to go through a phone screening first, but during the in-person interview, at the end of it, they gave me a sheet of like 10 questions. And was like, hi, pretend to be the interviewer, like you're in the position. I'm gonna be the individual that you're interviewing. So on the spot, I want you to, see how you're gonna go through these questions and asking sensitive questions, things like that. So they might not ask you to show your skills in programming, but other positions as well, they might ask you like in other ways as well.
Yeah, and also have a writing sample on hand, because we do ask for that.
Would you say that in terms of testing people, it's usually not like the first time you've talked to them? You've already passed like an initial, usually, like I feel like your first interview, for me at least, my experience, I've never been asked to show something until like the second interview or something like that.
It's usually after the screening and you've had an initial interview, we will then ask for like references and some of the samples.
Yeah, I've had to write I had applied for a job at Hopkins, and I had to write they gave me a topic, and I had to write some sort of like a quick needs assessment on this situation, or like, how I would do, and I had like 24 hours or something to pull that together. And I think I've also had to do like a on the spot like lesson teaching or something like that. But for me, those have always been later. So I think at that time, you would already have passed enough to know that you like need to maybe like brush up on how to lie about your skill set. I don't know.
The key isn't to like pretend and then you go to the interview and then you don't feel prepared and you're underwhelmed. And the thing is to get by the screener. Like, don't let someone deny you just because you didn't have the one word in the resume, because that does happen because people get a lot of resumes. So like, don't let yourself get pushed back, or let's say you don't meet all of the requirements for whatever on the checklist, but you meet 2 or you meet 3. Apply anyway, because they're either going to say no, and you might get to the 3rd interview and they ask you a SAS question and then you completely mess up and you have no idea. But maybe that still won't be enough, because maybe they saw your writing sample and maybe they think that they can do X, Y, and Z. But the point is to not let yourself get kicked out of that interview process before they really get to see that you could be an asset to the organization.
Any other audience questions? Yeah.
What's like the line between communicating with an employer and being like overbearing? Like when you're applying for a job and you want to follow up, like after an interview or something, like how do you do that tastefully or not like overwhelm them with emails?
So the question is about following up when you've applied for a position, in terms of how soon to follow up and how to do so in a professional way, and how frequently.
I would say after the interview, send a thank you like a thank you note. You could do it via email, and in that email, if you hadn't asked previously, you can ask like what the timeline is for hearing back. Don't bombard people, please. We're busy. Definitely, I don't know.
No, I think that's exactly what I would
Right?
say is like
Yeah.
always, like I helped to interview people for the fellowship, the Global Health Corps. I was interviewing like the next classes and I did it twice. And I had two people in front of me that were equally great. And then one of them sent me a thank you and the other didn't. And so I gave it to that person. But that is a really, I always
Yeah.
try to, when they ask you questions, always have that be your last question. When should I expect to hear? What is the timeline? And you can acknowledge, say, I don't want to bombard you with anything, so I would love to know ahead of time, like, when should I check in with you or not? Like, be upfront about asking that
Yeah.
question. I would say if you forget to ask and haven't, I usually wait like 2 weeks at least.
Yeah.
And then don't email them again, like, at least for another 2 weeks. But probably if they don't answer that one, then they're probably, not interested.
You want to?
No.
I think too, like when I was in the application process, I was submitting so many applications that I wouldn't know if somebody wouldn't call me back, which I think was great for my mental health. I did, yeah, I would send a thank you like the next day, because then it's like, they already had, maybe they had a whole day of interviews or something, and then I'm like, oh, hello, back in their inbox again, just for the day to say thank you. But then, yeah, I never reached back out to anybody, only if I was like, in the interview process and, I felt like they were maybe dropping the ball, we weren't scheduling right or something like that. That's probably the only time I've actually followed up with people after the thank you letter.
Something that was a little different that I've done in the past, I don't know if other people do this. I got this tip from my ex-boyfriend, so I've carried it on with me. But like something that makes it different is instead of like emailing them a thank you letter, I'll literally go into the office the next day and hand them a note, like a handwritten letter. And that kind of stands out, I think, compared to others, because you actually took the time to follow up, go to the office. I wouldn't say you can hand it to the person directly, or I'll just give it to the front desk person and be like, hey, can you pass this on to the interviewer?
Any other questions from the audience at the moment? All right. So I'll move down my list. So one thing I'm curious about from all of you is what your favorite thing is about your typical day.
So my typical day, the nice thing that I really like about my job is that every day is completely different. There's a new challenge every day, and it doesn't feel like it's monotonous at all. So a little bit about my background. Once I graduated undergrad, I took 2 years off before going back to school. So within those 2 years, I was working in labs. I know a lot of people love lab work, but it just wasn't for me, because once I learned the ins and outs of the job, which was 3 to 6 months in, then I was just on autopilot every day. Like it was just processing samples or doing this or doing that, and it wasn't challenging in the slightest. So I got to the point where I was training other people, and I thought maybe that would bring a new challenge, which was at the beginning, but then it just felt like I could be doing more here. Like I feel like I'm not performing up to my potential. So that's something that pushed me to go back to school, and that's what I was seeking. So once I started learning about the job that I have now, I had an internship where I was able to learn a lot about it, and through the minor as well. It's just every day is completely different. One day may be much more challenging than the next. A lot of times you have projects that carry on throughout. A lot of times you're kind of stumped and you don't know what to do, and you got to figure out the right person to reach out to. So you're always meeting new people within the organization. You're learning new things, and also I'm fortunate enough to be in a department that has a lot of people that are really experienced. So a lot of them have been doing it for 20 plus years. So any questions that I have or anything, they're like really great resources, and they'll sit and talk with me and teach me all about whatever I'm faced with that I'm having to deal with, which is really great, and that's probably my favorite thing about my job.
I'm gonna leave a little early, so I'm gonna answer, sorry. So something about my job that I like is I'm in applied public health, so I think it's really unique being at a government job that's local, because I believe we can see the change that we're implementing versus something more at a federal level. So it's nice to do these data analysis and provide recommendations for policies or assist programs with evaluation so that they can make changes and they can see the changes that are being made within a few years. So I think that's really interesting.
I honestly, I really like, I also have a lot of different things happening every single day. That makes it really interesting. I have some projects that are shorter term projects that have really specific specifications. So, you know, there will be like a policy, a medical policy that was implemented, and we want to see pre-post if providers changed the way that they were billing certain things, for instance. So that is like more rigorous, but it still allows for some innovation, I guess, for how to capture certain things. So if we're, you know, giving a provider report monthly that has members that are coming up high on our risk stratification engine, then we can say, okay, are they taking, you know, in the next months, are the providers using that report to then schedule more PCP visits, for instance? But then I also have some like longer term, more research focused projects, and those are kind of self-directed, which is really great. So we had an initiative for social determinants of health, or we currently have an initiative around social determinants of health. And so I learned how to do spatial analysis in R, which was like very new, and it was like, I think it's the first time someone's been doing it in our department too, so it's like I'm learning this entire new skill, and you know, in this software, that's really great. So honestly, I feel like I'm learning every day, which is exactly what I could have wanted because I love learning every day. And similarly, I'm the only research analyst, everyone else is a higher analyst level than me, and then have varied skill sets. So there are some people who have really, really strong statistics skill set, and then there are some people who, you know, can do a lot of automation in SQL, which I don't do very much automation. So there's always someone that I can go to as a resource, or they're experts in this one data set. If you ever get the chance of looking in claims data, it's the dirtiest, most sporadic thing you could ever imagine. So I might be a great analyst working with these two views, but if I'm working with any other data set, I have no idea what's going on, I have no idea how to capture anything. So I really rely on a lot of the other analysts across our department for being able to you know, yield my own research interests. So if I see some interesting study that's published on pharmacy data, and I don't work with pharmacy data, then I know who I can go to figure out how to quantify that, and then provide that same type of analysis. So it's very different, very inspiring, a lot of fun, different things going on at once. So I love every day.
Something that I would also say that I enjoy about my day, which other people have said, is how different it is and how I'm on multiple projects. Being on multiple projects is fun because it kind of switches up your day and you don't have to be working on one thing. And also, it's helped me gain my skills as well as just a professional. As I said, I don't have my master's degree, and I purposely took a break because I didn't know what I wanted to concentrate in going in for my MPH. And so since being here, I'm exposed to researchers, scientists, like lawyers, all different types of people, and we work on all these projects together. So it's a great way to just get exposed to different stuff, which I really enjoy. Another thing that doesn't really never has to do with my job, but I love the work culture. Like, they're not super strict. I think work culture is so important because you're there all day. You're there more than you spend time with your family, your friends. So I truly value that. You know, you don't want to be at a place where it's like you can't leave just for 15 minutes out of your desk to go grab a cup of coffee. I don't know, some people might be okay with that, but I personally am not. So another thing I enjoy is that my supervisor's not like on my ass all the time. Like, I can go do other stuff and she trusts me that I'm gonna get my work done, but at the same time I have other things that I might need to take care of, like go drop off my like laundry somewhere. I don't know, you know? So work culture is super important, but at the same time I do love my actual job as well.
No, I feel like that's really important, and something that kind of piggybacking off like what we were talking about interviewing before, is that I know everybody like really wants to get a job, but don't let that like desire to get a job prevent you from interviewing them. Number one, I mean, I'm sitting up here talking about myself. I love talking about myself, and most people that are interviewing like talking about themselves. So the more that you get them talking, they're probably going to think more favorably on you, honestly. So don't be afraid to like use the interview to say like, what's your favorite thing about working here? Because you don't want to just take a job that like makes you miserable just because you really need, I mean, maybe you do, but like if you can avoid it, you know, you might be blessed with opportunities coming every way, and you want to know, like, have that information. Oh, well, this person said, you know, there's a really micromanagey culture and I can't work under that. Or this person is like, hey, we're really flexible and we don't come into the office a lot, and that's something I need to be in the office and I need to be with my team, you know, so you should be also taking that opportunity too. And I think that is, for me, also one of my favorite things. I have no concept of what a typical day is because I spend a lot of time just like in other countries and on planes and different time zones, and I don't even know what year it is. And like, but the nice thing is that my boss is really flexible, and she totally respects work-life balance. In some regards, I'm being recorded. And no, but she really does. You know, it's like if I have a doctor's appointment, she doesn't have any problem like letting me, you know, come in. Or it's like, hey, I just really have a lot going on today and I need to work from home. And that to me has been really important in being able to do the work, because the work that I do is really hard and it's exhausting, but she kind of allows me that. And the other nice thing that I really like about working with Dr. Sood is she's very empowering. She has just like, you know, my first trip for this job, she didn't even go with me. She was like, I had never done a pretest. I had actually never done research before I took this research manager job. And she just sent me, and she was like, yeah, you'll be fine, right? And that was terrifying, but it also was incredibly empowering. And now I'm like, you know, able to go and lead research trainings in other countries without her there. And so she's given me a lot of those opportunities. And she has trusted me enough to like put me in those situations.
Great. I'll open it back up to the audience. Are there any questions? Yeah.
I'm just curious, like, do you feel, I don't think any of you have a PhD.
Not yet.
Nope. Do you feel any pressure to get one? Do you feel like not having a PhD might kind of hold you back from advancing in the field in any way?
Every day.
So the question was about doctoral degrees and advancing in the field.
At least in my field, I haven't felt any pressure to get a PhD because in a lot of fields, getting certifications can really get you to where you want to be. In my field, there's a really big certification. It takes a lot of studying to do and everything. It's a lot of time commitment, but then once you get it, it opens up a lot more opportunities. So I would definitely suggest that. I'm actually back in school to get another master's, so like I'm pursuing that as well. But I guess every single kind of place that you, like industry will be different in that respect. But at least in the healthcare world, it's all about, you know, what certifications were you able to get. There's a lot more clinical people, so that's a little bit different. But at least in administration, that kind of how we work, it's more like certification. So that would be my suggestion. And if you're lucky enough to work in a place, they'll pay for you to do your certifications, which is definitely like a big plus if you're able to find somewhere that'll do that for you.
Yeah, I don't think I'll go back to get my PhD. I think I initially thought I would, but I just was also considering if I get a PhD, how will that change my work post? So don't just do it to have, I mean, you could also just do it to have more letters behind your name if you want to, but for me, it wouldn't, you know, I would just be in school for a lot longer, and it'd be a lot long, and because I did the accelerated BS MPH, I was like done with being in school. I needed to leave for a while. But so to me, it wouldn't make a big difference. That being said, I think maybe if I was in a harder analytics, so like we have a more advanced analytics data science team that does a lot more of putting models into production. A lot of them have their PhD, and that's kind of where they cap their pool. So it also depends on what you want to do, kind of similar to what he's saying with field. But for me, I don't feel like it's creating a barrier. I don't want to just be putting models into production. I want to be doing more of the research aspect, and for now, I don't see a reason for me to go back, but you know, maybe that will change, who knows, yeah.
I would say that at the place that I work at, I don't feel pressure to get my PhD, kind of though, honestly, because I've been wanting to get into policy. My supervisor kind of has been like trying to get me to go get my law degree, but that's like another thing. But I think it just really depends on where you want to go. Like, if you want to be at an institute, like education research, maybe a PhD is right for you. But like, if you don't want to go into that, like, don't feel pressure to do it. I don't think you should feel pressure to do anything, you know. Do what you want to do, go for whatever your passion or dreams lie. You know, don't try to listen to too many people too often. But yeah, I haven't feel pressured to do that.
I feel pressured, and that's because I work in an academic institution. And I would even say I don't in any way want to only be a researcher. This is, like I said, my first research job. I had 4 years between my undergrad and my master's, so I had a lot of program implementation and more kind of direct field work. And then even right after my master's, I was doing much more hands-on work. But I do really love to teach, and it seems in a lot of ways public health is a slightly more forgiving field, depending on the university that you're working at. Here at Drexel, it seems like we have a lot more just full-time professors with their PhDs. At BU, we had a lot of adjunct who a lot of them had their masters. Many of them did have their doctorates, but they did other jobs during the day and then just taught like one class. And I do think in general, like, even if you want to teach, there are ways to get around it. But depending on what you want to teach and where you want to teach, it might be necessary. So, yeah.
All right, so we have time for one more. Yeah.
So we talked about maintaining connections and like in this process, talking and meeting with people. What does maintaining that relationship look like? Like, should I be reaching out once a month? Am I reaching out every other week? Like, maintaining these informational relationships. What does that look like?
So the question is about maintaining relationships over time that you've met professionally in terms of like informational interviews and through your colleagues and classmates.
I think sometimes it's how you do it too. I think, for instance, like, Gallagher, Professor Gallagher, if you guys know Gallagher, is great. I've just sent him articles that I thought he would also be interested in. So sometimes, keeping up with a connection can be like, oh, we have this one thing in common. Maybe I worked on this one project about maternal and child health with them, and that interests me, and I know that interests them. So let me just send that, and I can be like, oh, by the way, I hope you're doing all right. So I think it's hard because I don't think there's an easy rule that you can stick by, and if you do a lot of informational interviews, sometimes it's hard to keep up with a ton of different people, but I think, for me it was like having an informational interview and then seeing maybe it was a researcher and they had an internship I could work on or some project I could work on. Then I've built more than just the one interaction with them, and then I can keep that going by sending them things or, connecting with them on LinkedIn or, asking them how they're doing. I don't know, I'm not giving you a good answer for like timelines or anything, but I think dependent on the person, because also some people are really, really busy. Like if someone's like the director of adolescent gynecology, I'm not going to be hitting them up, so frequently, but trying to find those little ways that you can keep that connection going, I think is good. And, it's not like if you don't speak to them every month or every other month that they're going to completely forget you exist, but it would be worse to have constant communication that is meaningless, if that makes sense.
Yeah. I mean, I think that there's a lot of people that I've just met once, and then you always send them a thank you note, right? And kind of connect, and then that can be it. And maybe, if 3 years have gone by and I haven't talked to this person, then I probably wouldn't. But it does depend. Like, I would definitely take that, not to like encourage you to harass your professors, but like if you have like a professor or two that you really are, you've worked relatively closely or you just really enjoyed their class, do something like that to maintain those relationships, because they can be really key references for you throughout. But generally, I feel like I just reach out, you meet the person, I send a thank you note, And then, and I also still do informational interviews now, just to like continue to, I just went and talked to someone. I'm interested now in like learning more about behavioral economics, and I just went and talked to a woman about it, and she let me borrow a book, right? So then that was like this natural, because we got talking about this book and she let me borrow it. So now I have this opening to go and meet her again, right? So I think if you make a good impression, you actually like build a connection, there will be these natural ways to do it. Yeah, I don't know if you have any other thoughts on that. Just like following up.
I'm still trying to figure it out myself, so it's like it's hard. It's really hard. Yeah, I feel like there's no straight rules to it, and like everybody's different. Like you might have a really bad informational interview with somebody, and then have a really good one with someone else, and it's like I don't want to talk to that person again. Like I'm gonna stay over here. It's weird. Another good opportunity for just like little, because I think that is the point of just like little meaningful, like, so if you have a conversation about something and an article comes out and you're like, oh, hey, did you see this article? We were talking about this and I thought of you, right? Or if APHA just happened and I like reached out to a person I had met a while ago and I was like, are you going to be at APHA? And they ended up not being, but it was that enough of like a connection so that they know that you're still thinking about them. And I think most people that get into public health are good people that want to help other people. So, like, if I've met someone once and I forgot you, but I see that you've emailed me before and I'm like, oh, right, we did meet. Like, if I can help you out, I probably will. And so, and I think that, like, maybe one of my closing thoughts will be whatever help you get on your way, just make sure that you're reciprocating. Like, when people reach out to you for informational interviews, when you have that job, take them. And like if you're on a listserv and you know that there's jobs available in your organization and you're like, hey, I had that informational interview with that person, or I know this person was looking for a job, send them that link, right? Like as soon as you benefit from the system, it's kind of like your job to, I feel like it's our responsibility to then pay that forward.
And you can kind of think about it from the opposite perspective too, because you are all professionals also in the field of public health. Crazy, I know. But so how would you want someone to be communicating with you? If you had a meeting with someone, you don't need them to be emailing you necessarily, once a year or anything like that to know that you still value the conversation you had with them and that you would, consider them a good candidate for a role or, for someone else who is thinking about hiring, something like that. So yeah, I think just thinking about, letting that be just an informal or formal way of interacting and then finding those meaningful connections that then you can make. Because to me, it's like, okay, I worked on a research team with this one person, then a few months later after I'm done, whatever, I said thank you, and then maybe I'll connect with her on LinkedIn. Now she's on my LinkedIn, so she posts something, now I can like it or comment and be like, oh, great research you're publishing lately, stuff like that. So, but it's also it's your network, so you, just like anyone else, they're going to have a wide network too, and it's to use that as a resource and to use them as a resource just like they'll use you as a resource. So yeah, I think overwhelmingly people will want to help, and so if you just find those like meaningful touch points, it just boosts that connection, I think, too.
One more thing that I'll just add is you guys as students, like, use yourselves as connections, like, connect with other students as well. Like, you guys are all here for the same reason. I'm sure some of you guys have the same goals or, things in mind. Like, use each other as resources as well. Like, I graduated over a year ago, but I'm still in touch with people. Like, I graduated with Alia, and, like, we still interact and see each other surprisingly a good amount of times. It's really weird. But, like, the circle is small. Public health can be pretty small, so, like, stay in touch with each other, because like you never know who could help out another person. Be like, oh yeah, she was in my class, like she's cool, things like that. Yeah.
And I had my manager ask me, a resume came on her desk from someone from Drexel with an MPH, and they were like, oh, do you know this person? I'm like, yeah, bring her in for an interview. She's she's really great. She does her work well. So making that good impression on your peers and being a strong player in, group projects and, being able to rely on each other is valuable too.
All right, so we are at the hour, so I want to thank you all for coming. We all thank our panelists. you at the next event.